Well, good morning, everybody. My name is Pete Blasi, and I'm delighted to be here this morning to present a little bit about my senior health plan and talk about the Scripps disruption and how we could help. We've been a proud member of working with ResDec for, like you said, 8 to 10 years, and we just love working with the county employees, the retired county employees, and you know, it's been a real pleasure for us and the staff to work with the retirees, and we've really dug in and understand the plans that the county has, so we could speak knowledgeably about it. So we're very astute to that. Specifically, we work with those that are Medicare eligible. So the county has group programs, as you know, that are group Medicare Advantage programs. So and we're very astute to that, and that's the population that we specifically work with. So here's the presentation. Here is talking about what we're going to cover today. So we are going to cover is the Scripps disruption. And if you're affected, and the resources that we have to assist. So a little bit about the Scripps disruption. So this disruption affects approximately 30,000 seniors in San Diego, or I should say Medicare eligible recipients here in San Diego. So Scripps Clinic and Scripps Coastal will no longer accept Medicare Advantage plans, HMOs, or PPO coverage starting 1/1/2024. So, what does that mean? So if you're on a group program with the county, if you're on an individual program, and you have a plan that you're seeing a Scripps doctor, you will not have access to that physician anymore. You would have to pick an affiliated physician. And so we could assist you with that, and you have definitely a number of options. So, there's Medicare supplements, and that would be reverting back to original Medicare, which is original Medicare A and B, and to see to get access again to your Scripps Clinic, Scripps Coastal physician. So that's the Medicare supplement, and there's a cost to that. And it's really age banded. And so our representatives on the phone will explain that to you. Let's go. Explain that with you. Also, there's comparable Medicare Advantage options that are available with like UCSD and Optum and a number of other physician groups that admit to Scripps hospitals, but they have primary care physicians, as well. Now, what would happen if you just do nothing? I think that's a big question too. You will be auto-assigned a physician come 1/1 that's outside of the Scripps Clinic and Scripps Foundation physicians. So they would auto-assign you a physician if you just do nothing. So I think people want choices, and we have a free service. There's no cost to our service, and there's definitely choices available to you. Next slide. So a little bit about my senior health plan. We're located in La Jolla, California, but we are licensed nationwide. So whether you're in San Diego or you're in Iowa, we can help. And traditionally we've been reviewing the group programs and how they compare to the individual programs. And so we kind of go through that and the cost analysis for you and see if it makes sense to take a look at an individual program with Medicare, or what you should expect with your group program with Medicare. So we do that analysis for you, and there's no cost to it. If you do go on to these individual program, we're here year in and year out to reevaluate and review that program to make sure it's fitting your needs. So, because needs change from year to year, and there's different options available out there as well. So, we could definitely assist on that. That's kind of in the Medicare Advantage world. There's also the Medicare Supplement world. We kind of touched on that earlier. If you want to keep your Scripps position, how much does that cost? And, what do you have to do? Again, we can assist on that as well. We can assist in the prescription drug program because you'd have to purchase a separate prescription drug program, and we'll kind of explain that as well. So kind of walk you through it. Our reps have been with us on average about 10 years. They're much better than myself. They work with a Medicare eligible population day in and day out and really understand the programs, especially here in San Diego. But we're astute to many other states, and we're licensed in all the other states and represent those programs in other states as well. I think that's a really an important factor. Next slide. So again, this is a little bit more about who we are. We specialize in Medicare insurance products, and established in 2005, and we're located in La Jolla, California. We serve thousands of seniors nationwide, and we also have independent agent arm, where if you want to be seen at your home, especially here in California, we support hundreds of independent agents, in addition to our employed call center. So where you can speak with somebody and they'll answer your questions, and it's all confidential, and it's done over the phone in that environment. We go through education, enrollment, and support. So we really pride ourselves on support and answering questions, whether it's something you received in the mail and you're like, well, it looks like a bill, it feels like a bill, and many times it's not a bill, but you want a reassurance. Yeah, what do you have to do? So we take those phone calls and we do reviews, and we have a newsletter, and we do an annual review with our clients as well, every year. So we call ourselves a local solution with a national scope. And if anybody has a question, I'm definitely here to answer those questions today. And we just try to keep it broad. And if it's very specific to a very specific need, it might be better to keep it private, and we could set an appointment with one of our specialists over the phone. Next slide. So this is a little bit how we assist ResDec members. We really been working with ResDec for a number of years. So we understand the program, and we understand your support system there with the county, and all the way down to some of the people that are supporting you. So we know them too. So we look at things like, are you paying too much in premiums, compared to individual programs? What does your co-payments look like, with your current program, and then comparing that to the individual Medicare programs that are out there. Again, what's your prescription drug cost on that? What is it meeting your overall needs? And very, very importantly is, what type of coordination are you going through, and what, taking your doctor and your specialist into consideration when looking at the individual program. So these are all important factors when reviewing, a program, especially reviewing a program outside of the county retiree group program. So we've assisted, hundreds of county retirees and into individual programs. I think they've seen a benefit in that. But I think it's important to note that there's a number of retirees who said, hey, you probably for your needs and for what you have going on, it's best for you to stay in the county program. So we really look out, we look at ourselves like a consultant and look out for the best, whatever is most appropriate for the Medicare recipient. So that's our position, and it's really worked for us. So a little bit about Medicare eligibility. Who's Medicare eligible? So we're talking about those that are 65 or older, that are U.S. citizens and have been in the U.S. for at least 5 consecutive years. Those with special circumstances like ESRD, ALS, disability, Medicare eligible due to disability. So if you've been disabled for 2 years, you're eligible for Medicare as well. If you're already receiving Social Security benefits, you'll be automatically enrolled on your, on Part A on your 65th birthday, and then the senior can enroll into Part B 3 months before their 65th birthday, the month of, and 3 months after. I think it's important to note you generally receive the card about 3 months prior to your 65th birthday, and that's when you should really start evaluating your plans, even a month beforehand. But you need that AB card before you could actually enroll, even though the effective date won't be until the date of your birth there. The first day of the month of your birth, specific. Yeah. Next slide. At this time, I'd like to take any questions, and it could be, overall questions of the Scripps disruption, a Medicare broad question. I don't know, Mark, is any?
Yeah, I have a couple, Pete. I thought I'd put your contact information up on the screen while I ask the questions of you, if that's all right.
Absolutely.
Okay, so let me see. The first question I have is, if we are unable to qualify for health insurance that Scripps will accept in 2024, how do we assess moving to another provider, the insurance they accept, and the quality of care that they will provide?
So I guess the key word there is qualify. Is the question maybe they mean to gain access to their physician, I'm assuming, in 2024. So Scripps is no longer accepting Medicare Advantage plans for 2024. I don't want to be very specific about that, So you're not losing a qualification, you're losing access to your physician. So to gain access back to that physician would be through a Medicare supplement plan, or really out-of-network PPO plan with a Medicare Advantage program. And we could explore that if you really love that physician and see if that makes sense financially. If not, we could look into a Medicare Advantage program that maybe admits to Scripps, or even if you're open to UCSD, and find a physician and start a new relationship with a new physician in a new medical group. So yeah, UCSD is really great, and there's a number of them in town.
I'm going to go back up to the top. There was a couple questions that I missed. The first one that we had submitted was, what is the turnaround time for United Healthcare to approve applications for coverage, especially Plan F?
Well, that's a very good question. Well, I think generally they try to get it done in 30 days. Right now it's kind of a tough season because it's the annual enrollment period as well, and a lot of people are moving around. But generally they try to get it done in 30 days.
Next question is, many among us have established relationships with our healthcare providers and share continuity of care concerns that arise with Scripps' decision to no longer accept Advantage plans. Tell us more about the options we have to maintain our care at Scripps. Is a supplemental plan the same as a Medigap plan?
Yes, there's A through J as far as supplemental plans. So there's different options there, and with F being most popular, the cost to an F program could range between $200 to $300 depending on your age. And if when exploring that option, it would be prudent to pick a prescription drug program, because that would be a separate piece of insurance that you need to purchase. That's that doesn't come along with the package of the Medicare supplement. So, hope that answers that question. They are the Medigap, Medicare supplement, definitely generally the same thing.
Next question, United Healthcare PPO through the county. Are my Scripps green specialists still covered?
No. Well, it'd be out of network on the PPO with the county. So yes and no, I guess you could say. They'd be out of network on the PPO, I believe. You need to pay special attention to what is the out of network fees, because the co-payment arrangement has changed now, because you were in network. So that would be a good question for a rep to kind of go through and review those out of network fees for the PPO now, and maybe compare them to another plan.
I think I can answer the next question. It was, what is the county retiree group program? So the San Diego County Retired Employees Association, SD-SARA, oversees an existing group of folks that have in the past signed up for PPO and HMO plans. So SD-SARA manages those plans. They no longer offer those plans to newer retirees, but the ones that are existing that have had those plans for many years, SD-SARA still manages and administers those plans. I hope that answered your question.
Yeah, perfect. It's great.
Why don't we see the questions? We need to. Okay, what I'll do is for some reason it doesn't show on the screen, so I'm just asking them off of the chat. But if you like, whoever TP is, send me an email and I'll send you the question. You can email me. It's real easy. It's my email address is very simple. It's just ED, which stands for Executive Director, ED@resdec, RESDC.net. Next question. Did I understand you to say that some Scripps doctors are not part of this, or are these independent docs with admitting privileges to Scripps hospitals, and would the Scripps hospital charges be covered? Let me ask that again, Pete. Did I understand you to say that some Scripps doctors are not part of this, or are these independent docs with admitting privileges to Scripps hospitals, and would the Scripps hospital charges be covered?
Okay, that's a very good question, very specific. So there's an employed panel of physicians that's employed by Scripps, and those are the Scripps Green and Scripps Clinic physicians. Sometimes they call them the foundation doctors. So those doctors are no longer accepting the Medicare Advantage programs. Now, there's another panel of independent physicians that admit to Scripps, like the retiree was saying. Now, they could admit to Scripps, and that's in network. So the hospital is going to be in network, but you'd have to find one of these new physicians, and we could definitely assist with that, and compare the program and see if it makes sense to stay on the program and that you're currently on, and find a new physician outside of the Scripps Foundation doctors, or explore a new program with a physician that admits to Scripps outside of the foundation doctors. Mm-hmm.
Next question, I think I may be able to handle, but how do I know if I have a supplement or advantage plan with ResDec? So remember, we're ResDec. We don't offer medical plans as an association. I don't know if this person who is DN is the initials is asking about SD Sarah plans. That would be a question for SD Sarah. They offer plans, but only to existing folks that have had those plans for many years. And so if you want to ask another question specific to that, just let me know or just type it in the chat. Next question. Do all supplemental plans require underwriters approval to qualify? What criteria do they use?
So that's actually an excellent question. There's a couple of supplemental plans in town that are guaranteed issue. So generally you would have to be underwritten, which can be a real challenge for many Medicare recipients. However, there's a couple of guaranteed issue that they're kind of giving a holiday of underwriting, and we can really introduce those programs to you. Great question.
That is the last question that we have in the chat room. So I'm gonna stop sharing here. And I want to remind folks, first of all, I want to thank you all for attending again. Give us a couple days. This presentation will be posted on our ResDec YouTube page, and I showed you where that was at the beginning of the presentation. It's just at our website, easy to find. Oh, here comes some more questions. Is AARP one that needs approval to join?
Okay, so there's a couple of special circumstances with AARP that give you a modified approval, like you don't have to go through the whole underwriting, but we could explain that to you, and it's definitely one of the plans that we represent.
And I think that was the last question. You know, I'd like to take this opportunity to thank Pete once again and his team over at My Senior Health Plan, myseniorhealthplan.com. That's the way you go to get to their website. What we're going to do, like I mentioned earlier as well, we're going to send out an email with more information from My Senior Health Plan to how to access their services, schedule appointments, and then also we'll send a link to the ResDec YouTube page if you want to go back and view this on demand at any time. And this email will go out to everybody that's on this chat or on this presentation, because we registered through our database and we have your email addresses, and we'll get that out to you. So with that, Pete, do you have any closing thoughts or?
Yes, I just want to say thank you to Mark and ResDec and everybody that's on this phone call today. You know, we're here to help, and we really appreciate the relationship. And it's just been a pleasure to work with all the retirees over the years. And I just want to say thank you. Thank you, Mark.
Oh, thank you, Pete. And we thank everyone for their membership in ResDec. We so appreciate you joining with us at the presentation today. Once again, if you haven't registered for the holiday luncheon, it's coming up on December 14th at the Mission Valley. Why can't I think of the name of the hotel? Hold on, I'm going to share the screen one more time. Let's see. Give me a second here. Oh, there's another question too, Pete. Are you familiar with FEHB, Federal Employees Health Insurance?
Federal Employees Health Insurance. Not myself, but I'm sure our reps have reviewed it and have probably have some better knowledge than myself, because they're working with retirees and seniors all the time.
And of course, it's at the DoubleTree Hotel Mission Valley Hazard Center. And we hope to see you all there. So I'm going to stop sharing and say thank you once again. I hope everybody has a great and safe holiday season. We look forward to working with you in the coming year and having a bunch more events for you to check out as we go into the new year. And once again, I'm going to go ahead and exit the meeting, although there's another new message. Oh, it was my staff telling me. It was my staff telling me at the hotel name. So thank you, Marge. All right. So thanks, everybody. Really appreciate it and hope you have a great rest of your day.
Happy holidays.
Happy holidays.